Good afternoon, everyone, and thank you for coming out today. Before we talk about COVID-19, I did want to remind everyone today is the 1st of June, first day of hurricane season, and we actually have a disturbance located over the Yucatan Peninsula. It's called Invest 93L, or 93 Lima. And we were told this morning by the National Weather Service out of Slidell that it has an 80% chance of development into a tropical cyclone. That's now already been upgraded to 90% since this morning. It is too early to know where this system will end up, how strong it will be, but we are told that one way or another, because whether it's this system or other weather that's developing in and around the Gulf, we're going to have a very wet end of the week and weekend and maybe start of next week. And so we need to all be paying attention to that. Very heavy rainfall, so I'm asking everyone out there to be prepared. Go to getagameplan.org. Make sure that you are ready. There are differences between responding to a natural disaster when you have a public health emergency with COVID-19 as we currently do, and obviously when we do not. So we will continue to update you on this disturbance as we get more information, but we do encourage everyone to follow the Weather Channel, the local weather broadcasts, and local officials and so forth. Moving back to today's press briefing on COVID-19, I realized that you didn't have a chance the other day to get all of the numbers because we were having some technical difficulties with our servers or the domain site and so forth. I can tell you today we're reporting 425 new cases. That brings us to more than 40,000 cases total since the inception of this public health emergency. Right now we are ranked 10th of all states per capita for cases, and you know that at one time we were ranked number 2 in the country for that. So I want to take just a moment and thank the people of Louisiana for doing what was necessary to slow the spread and flatten the curve, and then to maintain that effort so that we went from number 2 to number 10. So I just told you we have 40,000 or so total. You see it there, 40,341. We also increased today the number of presumed recoveries, and we are reporting 31,728. Of the tests for today were positive, and that was on 12,261 tests. As anticipated and as I announced last week, we did exceed our goal of 200,000 tests administered in the month of May. We ended up with 206,858 tests. So that was well in excess of the 4.3% that we had set as our goal. So in the month of May, we more than doubled the tests that we administered in the month of April. And I would remind you that the minimum goal that the CDC recommends is 2%. So we're more than twice that, and we intend to continue testing at least that level going forward. We've also reached our goal of 10% positivity or lower on new results for the last 24 days. And we're getting really close to being at 10% overall since the inception of the testing many weeks ago. I spent the weekend digging into the data in close coordination with the Office of Public Health, with Dr. Bu and Dr. Phillips at the Department of Health, with the Fire Marshal, and with many others. And I'm pleased to report that we are seeing signs of progress. Louisiana is headed in the right direction, but I have to caveat that by saying there's still a lot of COVID-19 in Louisiana. It's in every community across the state, and so we still have work to do. We still have some restrictions that have to be in place, and as I've said so many times, we're not going to be fully back to normal for some time, and certainly not likely until we have a vaccine that is safe, effective, mass-produced, and then administered to some significant percentage of the population. But we are moving in the right direction. We're ramping up our testing, we're ramping up our contact tracing, and you're going to get much more information about this from Dr. Bu in just a few moments. But it doesn't mean that every region of the state is doing equally well, although we have less regions of the state today that are somewhat problematic than we've had in the past. There are a couple of areas where we need to continue to monitor very closely, but the truth is we plan to monitor every part of our state very, very closely. That's the whole purpose of the increased testing and the contact tracing. But you'll get that information from Dr. Bu in just a moment. But with that being said, I do believe and have made the decision that it is appropriate to transition into phase 2 on Friday of this week when the current proclamation terminates. And so on Thursday, I will be signing a new proclamation to move the state into phase 2. And at this point, I'm going to invite Dr. Alex Bu to come up and go through some slides with you. If you've got questions about those particular slides, I would ask you to ask them of Dr. Bu while he's here at the podium. When he comes back, when I come back up, obviously I'll conclude with some remarks, and then I'll take your questions. Thank you.
Thank you, Governor. As we've been doing since before we moved even into phase 1, the Department of Health, in coordination with the epidemiologists who work for the Office of Public Health and public health experts from academic institutions and hospitals in the state, continue to look at the data about how our epidemic is progressing and use that to really understand what path we're charting and understand and give recommendations to the governor and his office about how to progress and when to progress. Just going through the same information, and this will be the third time that you've seen us present the data this way. Overall, the top line, and consistent with the recommendation that it would be reasonable to go into, that the state continues to see decreasing symptoms of COVID-19, and that's as demonstrated by what we call CLI, or COVID-like illness, syndromic surveillance, people presenting to emergency departments with signs and symptoms of COVID, and it's the proportion of those individuals in comparison with everybody else coming to an emergency department. So we continue to see that decreasing. Overall, our cases continue to decrease, and we look at that through a variety of ways, and I'll touch on some of those in a moment. And we continue to see a decrease in hospitalizations. So this chart depicts that, but it also depicts the other point that the governor just made, which is that progress continues, but it is not even across the state. While we do feel that overall the trajectory is of decreasing, and you heard the data about lower numbers of deaths than we've seen in recent days, lower number of cases in general than we had months ago, fewer hospitalizations than really when we're on the upswing. We do have some concerns about various different areas that I'll talk through at a high level in a moment. But when we look at COVID-like illness in general, we can see that across the state, symptoms, people showing up to emergency departments with symptoms of COVID continue to decrease. With cases, we see a bit more of a mixed bag, where we have several areas that are not decreasing or increasing. There may be slow decreases, but we're calling those essentially plateaued areas. That's Region 1, the greater New Orleans area. Region 2, the southwest area around Lake Charles. Region 8, the Monroe and Delta parishes, and Region 9, the North Shore and Florida parishes. There's a lot of reasons that we could be seeing those cases not going down. Certainly, continued transmission of COVID being the most underlying cause. But the other is the work that we've been doing as a state, not just as the state government itself, but as state with partners in academic, hospital, and private sector labs to increase testing throughout the state, not just in communities that were under-tested, like our African-American communities and our Latinx communities, but also making sure that we're getting testing into areas where we know that spread happens more frequently and people are more vulnerable, like our nursing homes, our congregate settings like prisons and adult residential settings. And so it's expected that as we see that testing increase, we're going to find more COVID. That's going to mean that you're going to have more cases and give a little bit of a mixed picture here. But we also are tracking other metrics, like as we continue to increase the amount of testing, what's going on with the proportion of those tests that are positive, that percent positivity that the governor referenced, and I'll show you in just a few slides how that number continues to improve. And so that helps us as we're looking from a public health standpoint at understanding these plateaued cases and these decreasing cases in some regions, sort of balance that with an overall trend to say that, yes, even as you are finding more cases, as a proportion of total tests, that's still coming down. Region 6, the central area around Alexandria, Rapides, Senla, does, however, show increasing cases, and we're watching that very closely. Some of that driven by outbreaks in congregate settings that are in that region, but we also are seeing a fair bit of community spread as well. And so again, when we talk about the measures, as I will later on in the presentation, that despite this generally good trend, promising trend, the decreasing hospitalizations, the decreasing symptoms, despite that general positive news, we must continue to double down on the measures that we know work to decrease the spread and to reduce the risk that we continue to see spread in our communities of COVID. Most importantly being staying at home if you're sick and wearing a mask when you're out in public with people who are not from your household, whether you're outside or inside, and certainly if you're less than 6 feet away from each other. When we look at hospitalizations, we have consistently seen, by and large, decreases across most of the state. We've also consistently seen, unfortunately, a rise in hospitalizations in Region 8, the greater Monroe area. It is a relatively small net increase in that region, and we have not come close to exceeding the capacity for hospitals in that region, but it is a steady climb, as you'll see when we look at the actual graphs. Now we are also seeing a rise in cases, or rather in hospitalizations in Region 6. And so when you put that information together with seeing a rise in cases in Region 6, the central Louisiana, that's another area that we're watching very closely. And making sure that we're surging testing capabilities, both at the community and congregate level, but also making sure that we are getting contact tracing and messages about maintaining good public health in those areas. So if we look at the next slides, I just wanted to show you a few of the regions so you can kind of get a sense of what this data looks like and how we review it. So these are the statewide trends. Again, these are the similar graphs that we've shown you before. Some people may notice that there's a bit of a color change. Sorry for individuals who are colorblind, because it is a red-green map. But there is a bit of a change to the middle epi curve, in that now the CDC is giving us criteria on which to say there is a decreasing trajectory or a rebound, which is red. And so you'll see that alternating red and green in certain regions. But overall, as a state, you can see that the symptoms on that curve at the top, cases on that curve in the middle, and hospitalizations on that curve at the bottom are trending down. If we move on to the greater New Orleans area, Region 1, you'll see that the pattern is the same, maybe a little bit more extreme. We know that the Region 1 has done a really excellent job. Certainly the place with the earliest epidemic, the place with the highest rate of rise early in Louisiana's epidemic, but also really great concerted effort to dramatically turn that around and see a decrease. And as you can tell, when I described Region 1 as a plateau for cases, that's really because you have this long tail that we do think over time will continue to decrease. But just looking at the slope, it's relatively flat. Symptoms and hospitalizations, however, are down. Now, if we compare that to Region 6, a region where we have more concerns with the trajectory of cases and hospitalizations, you see that when we're looking at symptoms, largely as a result of smaller populations, the graph for symptoms is a lot more active and not nearly as smooth. And we see that in general there's a downward trajectory, but certainly not the kind of smooth line downward and continued decrease that we would want to see. So watching that very closely. When we look at cases, we see that there was an initial increase and decrease, but then subsequently there's been this sort of undulating rise now since about mid-April, and we continue to see that rise in cases, again, noting that one of the drivers of increased cases most recently is that we are detecting more. We know that Cenla was one of the most under-tested areas in the state, and both through the Office of Public Health and through partners throughout that area, through the help of the federal government with supply specimen collection kits, we've been able to get a lot more testing into that region. And as a result, we're finding a lot more cases. That means there's a lot more to be done on the ground to help Region 6. Region 8 is the other region that we have concern about, and we've talked about that in the previous two discussions about gating criteria. Again, syndromic surveillance, the symptoms have been going down since the beginning. In the past, however, we've had concerns about both cases and hospitalizations in this region. Hospitalizations continue to increase, again, at albeit a smaller rate and an absolute small number of increases. Fortunately, though, we're starting to see what we hope is the beginning of a bending of the curve in Region 8 with what looks like a plateau over the weekend. Now, if you sort of chart 14 days out on the epi curve, that middle curve. So again, it's very undulating. We know that this stuff can change over time. Region 8 is another area that was significantly under-tested for most of April, and May has been a big focus, trying to get more tests there. So we want to continue to see that as we get more testing in these communities, that we find fewer cases. And the way that that's going to happen is as we find people, as we do contact tracing in every region of the state, as we advise people to isolate if they're cases, as we advise people to quarantine, stay at home, if they've been exposed, that is how we're going to see these curves continue to flatten and turn by having people keep COVID out of our public spaces and allow our public spaces to open up more. So along those lines, we do want to share a bit of an update on testing overall and contact tracing. As you heard the governor announce, we had set a goal of doubling the amount of testing that we did in April at the beginning of May. This was a key goal that we shared with the White House and led to their support for the specimen collection kits that have helped us achieve this goal. But that's sort of a necessary but not sufficient tool to get to where we need to be with our testing. And the real drive was people across the state, academic partners, private labs, facilities themselves really standing up and partnering with us to get people tested in large numbers and to reach communities that we hadn't had enough reach to in the past. We did, one day early, achieve greater than 200,000 tests reported to the state in the month of May. And importantly, as we saw that rise in overall tests, as depicted by this yellow-orangish line on the graph, we saw a continued decrease in the percent positive results coming back, as depicted by those blue bars in the graph. And so that's what we want to see. We want to see that we're getting tests out enough that it's changing behavior, changing our ability to influence the dynamics of COVID-19 and see fewer and fewer cases returning positive back to us. One of the ways that we do that is through contact tracing. We've been doing that since the beginning of the outbreak, but as you all know, because of resource limitations and the pace at which cases were rising early in the epidemic, we have not been able to do statewide contact tracing in the way that we wanted. Moving into phase 1 and right before, we really surged our capacity as a state to engage in contact tracing so that we could move into a suppressive mode where what we're really doing is, as we find a case, reaching out to those people ideally within the first 24 hours of being notified of that case, giving them counsel and advice on the protective measures they need to take for themselves and anyone that they're living with, certainly to isolate, and then also trying to find out who might have been exposed as a result of their infection and reaching out to those individuals, those contacts who had been within 6 feet for greater than 15 minutes, so that we could reach out to them and also advise them to stay home, take measures to protect themselves and their family members from exposure, to monitor for symptoms, and if they already had symptoms at the time of our outreach, to be tested themselves. so that we can really try to identify, isolate, and sequester or move out of general public the individuals who either are infected or may become infected. We had more than 250 Louisianans online as contact tracers after May 15th and have since been able to hire 613 Louisianans to serve in this capacity, with more than 303 of them trained and doing this work. And the training continues. We're trying to get really that full number online. We've also been doing a lot of sharing with the media and other venues so that when people get calls from the Louisiana Department of Health, they're not caught by surprise. This shouldn't be something that causes you a great deal of concern. It's really an opportunity to learn more about what's going on with potential exposure to COVID-19 and to do your part as a good neighbor to help prevent the spread of COVID-19 in our communities. And this will only be successful if people continue to take part, to answer that call, and then to help ensure that we protect our neighbors as much as possible. This is a real opportunity to do what Louisianans do best and look out for each other by doing our own individual part. Our goal is to make sure that we don't just have the capacity to reach everybody, but that we do reach people and that they do answer the calls, and that we're able to not only give them advice on reducing the risk to themselves and to the community, but also importantly provide or understand the resources that they may need in order to be successful in staying at home during that period of time, because we know not everybody has the means to just easily stay in their house for 2 weeks. And so far we've been able to engage over 219 cases and contacts that we referred for further resource support to be successful in staying at home. So as a result of that, with the data again being promising, and seeing the increases in testing, seeing the increases in ability to do contact tracing, we felt it was reasonable to move into phase 2 as we continue to see these trends go forward. And so wanted to touch a little bit on what phase 2 looks like. The overall big difference between phase 1 and phase 2 is in phase 1 to understand how to maintain strict social distancing of greater than 6 feet amongst individuals, working with the fire marshal's office and understanding how indoor settings are regulated or set up. We'd initially had an occupancy restriction of about 25% for those facilities. And so now as we move into phase 2, that restriction will relax further to allow up to 50% occupancy for most of these venues that you see here. Keeping in mind, the goal should still be to stay 6 feet away from each other. We can be creative about how we do that, perhaps sitting all on the same side of a table at a restaurant, having other people sitting at the same side of a different table at a restaurant. There's going to be net 6 feet managed between those groups, even though there may be more tables now in that restaurant. And so some of that is going to be managed by the people who are the business owners, who are going to be really enacting these restrictions. A large part of it, though, comes back to us as Louisianans and how we behave and how we make choices about taking part in these various sectors that are expanding access. We'll note that in blue on this list we have sectors that are going to be added to the proclamation now in phase 2 that were not open before, and this brings in much more of places like day spas, tattoo shops, some recreational facilities like controlled swimming. We know that we're in the middle of, or we're entering summer, and it's going to be a hot one, and so we understand a desire for people to go out and cool off in any way they can. Again, just reminding people to just be conscious of where they are, be conscious of the fact that pools are going to be required to have individuals watch the pool to make sure that we're not congregating, that we're not in contact, that we're not going to be having just free, uncontrolled swimming. This will still be with health and safety measures taken to reduce the risk of transmissions. Nothing reduces the risk more than staying at home, as we've said previously, and importantly, it's important to highlight that individuals who are at high risk for poor outcomes from COVID-19, so individuals who themselves are older than 65, 65 or older, people who have heart disease, hypertension, diabetes, lung disease, people who have severe obesity, and any reason that your immune system is not working as normal. The recommendation is that for you, you're still essentially in phase 0. You need to stay at home if at all possible. Reach out to friends, neighbors, families to help with delivery of groceries and with delivery of medications. These sectors that are opening up are not really intended for people in those high-risk categories because, again, there is still a lot of COVID in our communities. We estimate about a little over 8,000 cases based on the cases that we know of, but we know that the cases that we know of don't touch all of the cases that are in the state. And so even as we open up these sectors, it's important for us all to be very mindful of the fact that the threat from COVID-19 still very much remains and that we need to take steps to make ourselves and others safe. And on that last point, I would just point out, even if you're not in a high-risk group, you need to evaluate whether you live with somebody or come into a lot of contact with somebody who's in a high-risk group. And as you're making decisions about the risks that you take very much on board that you could present a risk of acquiring COVID-19 and transmitting it to somebody who themselves could have a really bad outcome. We've been fortunate to have the fewest numbers of deaths reported since we began, in the last 2 days. But we want to keep that trajectory. I think nothing would make me sadder than for us to suddenly have that rate increase, and I'm sure that that's true for the governor as well. So there's some practices to make this work, to be able to re-engage the economy, to be able to start this work of restarting our economy that we all have to do. It's not that we can just return to normal life pre-COVID. And the most important thing that we want to emphasize is really the new normal of wearing a mask. That is going to remain until we have adequate herd immunity, until enough of us are protected from COVID-19 that the risk of spread widely is dramatically reduced. And public health experts tell us that without a vaccine, that could take up to 3 years. And so that's something to keep in mind, that we really need to be building in to our mindset comfort with the masks and the use of the mask, and the comfort with telling each other and reminding each other to wear masks. Because what we've learned, especially since in the recent months since the outbreak, is that one of the main modes of transmission of this virus really is through the particles leaving our mouths and nose as we cough, sneeze, yes, but also as we speak, also as we sing, also as we play instruments. These are ways that the breath in our lungs it flies out and into the room, and that's how so many cases of COVID are being spread in our communities. Masks are a really critical way of keeping what I'm breathing out, sneezing out, coughing out from reaching all of you, and so vice versa. It's my role as a good citizen to wear that mask and avoid you becoming inadvertently infected. Because the other thing that we've learned through this epidemic is that a significant number of us may have COVID-19 and not have symptoms, and thus inadvertently we could be spreading. And that's why, even if you feel well, we do recommend you wear the masks. Would also note that all the good hygiene practices that we've talked about before, we need to continue. Stay at home if you're sick. Even if it's not COVID-related illness, COVID has shown up in symptoms like an upset stomach, or as we've seen with very young children, sometimes what looks like an inflammatory syndrome, where we have challenges with other body parts, other organs in the body. It's really hard to really say something is definitively or not COVID. The safest thing you can do is stay home, call your provider, and get advice from them on what kind of testing, what kind of measures to take. Certainly wash your hands and maintain distance. Again, if you don't need to go out, don't. If you don't need to be close to people that you don't know, don't. And when you're going to one of these places that you want to engage in the public, if you see nobody's wearing their masks, if you see that there's too many people, they're not adhering to the guidance that the Office of Public Health, that the State Fire Marshal has provided, do your job as well as a consumer in not patronizing that area. Don't put your life at risk for something like a bowling game. You need to look and see, does this look safe? And that's going to be how we make sure we all are doing what we can to reduce the spread. Again, most importantly, we want to reduce the risk for the most vulnerable amongst us. And so I just want us to be conscious, and we'll continue to provide more guidance on not only taking measures to reduce our risk if we ourselves are high-risk individuals, but thinking about the people around us, the people that we interact with, people that we live with, and not putting ourselves at risk if we could transmit COVID to them. And for employers to think about, who do I put on the front lines dealing with customers, making sure that we're not putting high-risk populations on the front lines and at risk, making sure that we're also asking people who themselves are not high risk on the front lines, do they themselves have people who are in high risk in their households, and are there other positions in my business that I could put them in that would reduce their risk of transmitting something that they get at work to their family members and result in a poor outcome. So there's a part of this that all of us can do, and I appreciate the continued support of the public who by and large are wearing masks and doing all of these measures. And as we move into phase 2, we need to redouble those efforts and continue to work to reduce the spread of COVID-19. So thank you. And so with that, I'm happy to take any questions. Sam?
I think you said the state has reached out, it's reached 219 contacts or cases. I guess I'm wondering, that seems really low considering we've had more than 6,000 cases since May 15th, and if you've reached out to 90% of them, that's like 5,400 people. Is that just a really low rate, or am I reading that wrong?
Sorry, those are individuals who are getting resource coordination. So of the people that we reach out to, most people are able to stay at home through their own means. They have family members or others who can support them. 219 is the number that needed a bit more, whether that's housing support, food support, these other social supports that are really critical to being able to be successful in staying at home for isolation or quarantine. So
there's how many of that 90% you actually reached?
I don't off the top of my head. I can tell you that we do have challenges with people not answering the phone, even though it says LDH. I can tell you that even when we do reach people, many people don't always remember the numbers of people or the names of people that we're trying to reach. And so one of the things we talked about before we started contact tracing, we continue to do, is try to gather as much data, not only from within the state, but from other states about what's successful, how can we improve the impact of contact tracing, because that is really our critical weapon against COVID-19. And so we are continually trying to learn from it to make it more effective. Other questions? Please.
As far as the assisted living facilities and things like that, they were included in nursing homes. So we were posed the question, why were the assisted living centers kind of lumped in with nursing homes as far as not having visitors and things like that?
So in general, when we think about congregate settings, there's sort of two risks that we worry about. One is the risk of transmission within that setting. We know that there's a significant amount of asymptomatic spread from COVID-19. Studies from the New England Journal and others have shown very high levels of people who have no symptoms that are later found to have had COVID or have active COVID. That presents a real risk in a setting where we're going to be in very close contact, but we're not necessarily able to keep ourselves separate. So in that way, an assisted living facility is somewhat similar to a nursing home. Nursing homes present another specifically unique risk category for bad outcomes for the people who actually live there, because either they're more likely to be 65 or older, or they're more likely to have one or more of those underlying conditions that put them at a higher risk for a severe case of COVID and potentially death. And we've had a significant number of our deaths in state associated with those nursing homes. So we're trying to certainly address both of those. And we do make a distinction between nursing homes and assisted living and other adult congregate settings in the way that we report the data, because it's not fair to sort of paint everything with the same brush.
Another question, museums like the Knock Knock, not open, but some other areas, parks, etc. are open. Why the distinction?
So one of the things we have to think about is what's going on in a setting, and what makes a certain museum high risk or not, and it really comes down to how is COVID spread. So when we think about any of these settings, it's spread through the air by the things that are coming out of our mouths and noses as we sneeze, cough, and breathe. So generally, walking through a museum where you're not touching anything, you're sort of reading tableaus, you can be spaced and move along in an orderly fashion. We think that presents a lower risk than a setting where there's a lot of congregating around certain objects, or in this case where you're specifically touching or playing with communal items that are really hard to keep clean. And that's been a cause of a lot of discussion as we think about moving children's museums back into phase two, thinking about those exhibits. So it's not enough to say that they're just, again, open for normal business. They're going to have to look at their own exhibits and present ideas to us on how they're going to limit the risk of spread because people are touching objects and then inadvertently touching their faces. I think everybody doesn't want nobody wants their facility to be the cause of a spread of COVID-19. And so what we're trying to do, both with the fire marshal regulations and with OPH recommendations, is empower people to understand the best practices to reduce the spread. Please.
Dr. Diaz, so those nursing homes are going to remain closed until definitely through phase two, but how much longer do you think?
So it remains to be seen. I think there's really general agreement that group really presents the highest risk for COVID spread. And so even if you look at the White House guidance, they clearly say no visitation in hospital and nursing home settings in phase two. What we don't know is what next month is going to look like several months down the road. As we've said before, we know that there's work on a vaccine. It's probably a year away. What we also have seen, though, is that in a pretty short amount of time, a medication can come on board that suddenly changes the way that we manage the disease. Remdesivir is not a silver bullet. It's not enough to say it's okay if somebody gets infected, we can cure them. We're not at that point like we are for, say, hepatitis C. But we don't know what later in the summer, what early fall will bring. Not only that, also just the ability to have more and more personal protective equipment is another area that we don't know. So you could imagine a future in which we had adequate ability to protect individuals in those nursing homes and to have very closely monitored, closely coordinated visitation where people are wearing high-grade personal protective equipment. Because we have to balance the risk of COVID spread with the risk of loneliness. And in an older age group, the risk of loneliness itself can be deadly. But a lot of that, there's a lot of factors that change over time. So it's hard for me to predict when we would allow, when we would say that it's safe under certain conditions to reallow visitation. But I can tell you those are active conversations that we have with those communities, with the healthcare settings all the time.
Can you explain the rationale for keeping higher restrictions on bars and making them operate at 25% capacity?
So again, this is an evolving epidemic, and we learn more and more over time. Even since the White House guidance first came out, we've seen settings like bars in the UK and especially in South Korea actually be big driving forces of outbreaks of COVID-19. And so in those settings, they've actually shut down having bars opened up. So they had to open them up, and then they had to go back later and say, this caused too many outbreaks, we have to shut these facilities down. We would rather open in a slow, steady, safe manner rather than to have to snap back restrictions. And so as we were looking at the White House guidance that says bars should open up, and more recent data that clearly shows bars are a very high risk for spread of COVID-19, how do we move forward and try to engage as much business as possible while reducing the risk as much as possible. And again, that's not to say that bars are going to be safe. People are going to have to be very thoughtful as they're in these bars and take those precautions on board. It's really in an individual's hands how high risk or how unsafe any facility is that they go to. But for bars, the restriction is essentially that the patrons will have to be seated at tables at 25% capacity. That both reflects the fact that overall capacity in a bar is regulated differently than in, say, a restaurant. But it also means that you're essentially turning the interior space of that bar into similar to what restaurants were doing as far as having to be spaced, having to be seated. We hope that will reduce the risk of what we've seen in these other settings where bars present a very high risk for transmission of COVID-19. And
that's a lot of information, and you did a great job, Dr. B, and I want to thank you. So while phase 2 does, under the White House guidelines, does say that bars should be open, it also says at reduced capacity, especially as it relates to standing room. And so that's why these additional restrictions on bars. Obviously, those bars with LDH food permits, they will be treated just like restaurants, and that continues in phase 2 as well. A while ago, you asked about nursing homes being closed. I'm assuming you meant closed to visitation, and he answered that question. And obviously, we want to reconnect family members, loved ones with folks in nursing homes as soon as it is safe to do so. And when that happens, it will probably be subject to additional measures to make sure that that's safe. And we don't know exactly what that's going to look like yet, but we do know that under the guidelines that were issued by the White House, that is not a phase 2 activity. With respect to children's museums, they are not closed in phase 2, but they will be allowed to open, but with certain changes in the way that they operate, so that they are going to close down periodically to make sure that they are cleaning and sanitizing, and there may be certain tactile exhibits that they're going to have to close in order to be open. But we are not, and in fact, there'll be a call with the children's museums in about 30 minutes or 45 minutes or something like that to really go through all of that. So obviously, ongoing data collection and analysis is going to continue to be a part of our COVID-19 response going forward. You've just heard the key differences between phase 1 and phase 2. You know, in this phase, day spas, tattoo shops, and just a few will be able to operate. And by the way, that'll be under certain restrictions. And as it relates to those, and really every sector of our economy, we have received tremendously valuable feedback from the task forces operating within the Resiliency Commission that we created. And everywhere that we've been able to incorporate their recommendations into what we're doing as we move forward with this phased reopening approach. This proclamation will be in place for 21 days. So it will expire on June the 26th. And we will go through another analysis to see about the gating criteria and what comes next based on what we learn, both as it relates to the data and what we learn about the virus itself over the intervening time period. While we are moving into phase 2 and lifting restrictions, I do want to emphasize that, as Dr. Bu mentioned, there is still risk involved. There is no way for me to stand up here and say that if everything operates just as we prescribe it, that renders it completely safe. And by the way, there's nobody in the world that can do that. So everybody needs to take personal responsibility. Make sure you're doing what we're asking you to do. You probably shouldn't patronize businesses and establishments that don't engage in the types of risk mitigation that we've talked about here today. When deciding whether or not to do an activity, it's helpful to have a way to think through how much risk that you would be taking, that you're comfortable with, and that depends upon your individual circumstances as to whether you're more vulnerable because of an age or chronic underlying health condition, or because it is more important than ever that individuals wear masks when they are in public and not dealing only with people from their immediate household and they're unable to stay more than 6 feet away from one another. And as Dr. Bu mentioned, the more we learn about this particular disease, we know that the greatest risk of transmission is of an aerosol nature. And so the masks really do tamp down on that. I would encourage you to again patronize businesses that are engaging in the basic safety measures, and I encourage every business out there to make sure that they're doing what we're asking of them. I can tell you that in addition to requirements businesses must follow to reopen in phase 2, the Department of Health has worked with the Fire Marshal's Office to include in the Open Safely guidance for phase 2 good business practices that businesses can consider to help keep their employees and their customers safe and to make their customers feel safe so that they will return in the numbers that they need in order to be successful. These include reservation systems, symptom checking of customers, strongly encouraging masks among customers, and so forth. LDH, in fact, has created a thank you for wearing a mask posters that businesses can download from the LDH coronavirus webpage. They can print and hang those in their storefronts to show that they care about their employees and their customers. More specific guidance will be provided by the Fire Marshal's Office via opensafely.la.gov. And I want to thank everyone who's been taking the necessary precautions because without doing that, this next step wouldn't be possible, and we would not have made all the progress that we've made over the last number of weeks and months. And so I would encourage everyone in Louisiana to keep up the good work, and to remember we all have been in good communication with our office, but with the public at large, and for the role that they're playing in helping our citizens. And I want to thank everyone for keeping their focus on the issues of concern. Obviously, what we saw captured on the video and the unnecessary death of George Floyd, the behavior of that Minneapolis police officer was egregious. It was very far below property damage and those sorts of things. We're going to continue to work with local officials, federal officials, and all the state agencies to monitor the situation so that we can be aware of that work. So I do ask for everyone's continued prayers for our state, for our nation, and so that we would focus on the changes that we need to bring in our society. Those done. So with that, I will take some questions. That was a long briefing, y'all. That's about 50 minutes. Yes, sir.
Governor, on the George Floyd case, media reports say the president addressed the governors. I assume you're on that call, and said that the governor's actions have been weak, encouraged a kind of a more firm crackdown on protests and those committing, if not violence, committing damaging property and things like that. Do you believe that the governors overall have been weak? Do you agree with the president's assessment?
No, look, I'm not going to engage in that. I was on the call. I think the president was directing himself to certain states where there were obviously many more problems than we have experienced here in Louisiana. I've got all that I can say grace over here with a public health emergency, a legislative session ending today, another one starting tonight. We've got an economy that is not performing because of the public health emergency, and we have our own issues related to these protests. And so I'm just not going to engage in that at all, Greg.
Governor, is it time to revisit some of the policies and practices after you see something like this happen? Is that a time to kind of go back and revisit some of the things that are probably in the past and caused and led to things?
Yeah, and I suspect, and your question could potentially be better addressed to a law enforcement officer. I don't know that you have to change the standards because what that officer did is not in any training that he ever received. That was inappropriate. It wasn't standard police work. It was a gross departure from what is normal and so forth. And it was bad enough with respect to that officer. It's made worse by the fact that you had 2 or 3 other officers standing by who didn't intervene and correct the situation on the spot before it ever got to the point of Mr. Floyd's death. And I don't know that new standards have to be developed. We have to make sure that we're training our officers according to the standards that we have, and that we're not employing officers who shouldn't be police officers.
So is it a chance to revisit some of the things? Because sometimes when things happen, it's an eye-opening situation. You know, should you revisit?
Sure. And I think you should revisit the way that we train on the standards that we have. Maybe I misunderstood your question. What that officer did is not appropriate police work anywhere. And so that's not a standard that officer was engaged in. But we need to train them on what the appropriate standards are, train other officers to intervene if they see something like that before it gets to the level of someone's death or serious bodily injury. And then probably we need to do a better job at the outset of hiring officers who ought to be police officers and then monitoring that over time to make sure that someone who demonstrates that they probably shouldn't remain employed, that they don't get that opportunity to remain employed. Leo?
It seems like it took us forever to get here to phase 2, but if everything holds true and our trends are good, what's the likelihood that you would begin to consider phase 3, especially as we go to school and sports?
Well, look, we've got a proclamation we'll issue Thursday. It's going to expire 3 weeks from Friday. What is that? The 26th of June. And we will determine between now and then whether we meet the gating criteria again for an easing of restrictions. And I don't know how to be more precise than that on June the 1st. I can only tell you that the people of Louisiana will continue to do what they have done and follow these protocols that we put in place, then I feel really good about our opportunity to move forward. And we know that in August, schools need to resume, colleges need to have students on their campuses and all of those sorts of things. And we're not there yet, either in terms of the calendar or in terms of knowing what the circumstances are. But as we get closer, we will know more, and I expect that we will continue to get additional guidance from the CDC and other areas that we can take into consideration as we formulate our plans and make our decisions. Yes, sir.
Governor, can you, two-part question, can you address day camps and sleepaway camps, what the status of those is? And that's a big part of childcare and
Yeah.
the workforce again. Also, can you respond to the letter that Jeff Landry and a bunch of Republican lawmakers sent to your office asking for all businesses to be reopened under the same rules?
Yeah. Well, first of all, sleepaway camps are not going to be allowed. There's just too much physical contact for too long periods of time and so forth. Summer camps actually in phase 1 were allowed. If you recall, we put some restrictions on that with 1 adult and no more than 9 children, asking that they not do assemblies of all the kids present, and that they, whether it's for enrichment activities or for recreation or even for feeding. That's going to change because I think now we're going to be 1 adult per 24. So it'd be 25 in the group, but 1 adult for 24 students. But again, they were open in phase 1. We're just going to increase the number of individuals. With respect to the letter that I got, obviously I got the letter, I think, delivered to me over the weekend. I was happy to read it, and like the people who sent the letter, I too want to make sure that we can re-engage as much of the economy as possible, but as safely as possible. There are reasons why businesses of different types are treated differently, and that's because of the risk involved with respect to the public health emergency. And the decisions that we made all along the way have been consistent with the White House phased reopening guidelines that were vetted by the CDC, and which themselves treat different businesses and different activities differently. And so that's why we did that. That's why we continue to do it. And you know, it didn't just happen in those guidelines. The U.S. Department of Homeland Security, working through the Cybersecurity and Information Security Agency, has actually promulgated at least three, maybe more, sets of guidance on what is essential infrastructure related to businesses. And so we have followed that as well. So it wasn't just in the guidelines, it was also in the Department of Homeland Security information that they have now put out 3 times. So we're doing what we can to strike the right balance between re-engaging as much of our economy as we can, reopening businesses, getting more employees back, getting more customers in, all of those sorts of things, with the demands that we have on the public health emergency. And we're doing it in a manner that is fully consistent with the CDC vetted White House reopening guidelines. And I would remind the folks who sent the letter and everyone else that at the outset of this public health emergency, unlike many other states, in fact, every state that had the kind of cases that we had on a per capita basis, and in fact, no other state had the case growth that we had here at one time. But we left all manufacturing open. We left all construction open. Non-essential retail wasn't closed here. There were many other states that still haven't come close to our per capita cases, that when they reopened retail, non-essential retail, they did it for curbside pickup. Well, we never closed the stores here. So I would just encourage the folks who wrote the letter to take those things into consideration, and we're going to continue to work with them and others as we move our state forward. Yes, sir.
Governor, what would you say to people who naturally get confused with conflicting science? The WHO has said that masks aren't recommended. That goes back to the original science that you and Dr. Adams initially said, and then now the CDC and you and Dr. B all says masks are it's confusing for people to hear different sources, and from different sites.
Yeah, and quite frankly, I'll accept as true what you just said. I didn't know that the WHO may not be advising individuals to wear masks. I will tell you that the guidance here in this country changed on that a long time ago. The CDC initially advised against it, but as they learned more about the virus and the means of transmission, they changed that to advise that we wear masks or face coverings, regardless of whether or not we're symptomatic, by the way. And that's something that I can tell you the Office of Public Health here in Louisiana agrees with. And as we have learned more about how this is spread and the fact that the biggest risk of contracting disease comes from exposure to airborne particles, the aerosol that happens when people speak and cough and sneeze and so forth, it just makes it pretty clear to me that wearing a mask is essential. If we're going to keep a lid on the cases as we bring more and more people into contact with one another and reopen businesses and get places of worship functioning at a higher percentage of occupancy and all of those things. And so I guess there's always going to be some degree of confusion as guidance changes over time, but the guidance on the mask has been clear for many weeks now. It's consistent here in the United States of America, and everything we're learning only makes it more important, not less, going forward. Yes, ma'am?
Governor, the legislative session is ending. Do you have any comments on what has been accomplished in your mind, and has any agreement been reached on tour reform?
Well, you know, I know that there was meetings that continue to happen. I'm not aware of an agreement on Senator Talbot's bill before I came in here. There are discussions taking place. Obviously, the legislature is going to go into a special session tonight because it didn't take up the money bills and many of the essential things that we need as a state to move forward. And I will have more comments about what the legislature did when it concludes its work and we know the bills that passed and have an opportunity to review them. I will tell you it has been a very unique session. In the sense that it was interrupted by such a long recess, and then the lack of access that the public has had and so forth over the last several weeks. And we're going to take a good look at all of the different bills that get sent up to me by the legislature, and we look forward to having a productive special session because, as you know, Melinda, we have to have a budget come July 1st. We can't run a deficit, and so we have to have a budget in place when the new fiscal year starts. That's critically important, and so we're going to be working with the legislature to make sure that those essential bills that they didn't get to in this regular session are the things that they focus on and get those done in the special session. Yes, sir.
Governor, it looks like the legislature is going to put on a bill on your desk that would take the $300 million of the CARES Act money and send it towards small businesses. I'm wondering, is that a non-starter for you? Are you going to veto that bill? And do you think that you need the legislature to appropriate that money through a bill, or can you do it on your own?
Well, if you will recall, when we submitted both the supplemental bill to the legislature and the appropriations bill to the legislature, it included all the CARES Act money. So there was never a time where I or Commissioner Darden didn't anticipate and try to have all of that money appropriated. We think that that's the best way to do it. And so I'm not sure where that confusion ever came up. I don't have that bill yet. I haven't been able to read it. I don't believe it is finally passed, and I don't ever sit up here and tell you what I'm going to do or not do before I have an opportunity to read a bill. And so it will depend on what the conference committee does, what that final product looks like. One more question, and Leo, you get it.
Back in September, Freeport McMoran made an outstanding settlement on the offshore litigation of $100 million. Now that appears to be failed because there could be a consensus on how to spend it. What's your position now as far as the social lawsuit?
Well, I don't know that because I want to make sure I understood your question. I don't think the Freeport-McMoran offer to settle has been tabled. I think that still remains pending, and obviously it is contingent upon some other things happening. The bill that was introduced, that was, I believe, an effort to derail that, is what got tabled. And so we have to see how that plays out going forward. As you know, these lawsuits started in 2013 by parishes who were filing suit under express statutory authority given them in the coastal management program. And the state hasn't filed any such lawsuits. So I believe that the best thing that can happen is for the courts to determine whether or not there's liability and damages, and if so, what that looks like, and go forward. It would be my hope that, and by the way, I've never heard anybody say anything other than if damages are recovered, the damages ought to be spent on the coast where the damages occurred in order to do as many coastal restoration and protection projects as possible. And I know that was what animated some of the concern that we heard about in this session. I think that's the way this is going to play out. But going forward, you know, we have cases that have been filed, some as long as 7 years ago, and I think it's time that we find out whether the courts believe that there's liability and damages, and if so, how much that is. But any recovery needs to be spent on the coast. So we will be back with you all when, Christina? Wednesday at 2:30. Some of the questions you asked today will probably be more appropriate Wednesday at 2:30. But thank you so much.